The following is a paid advertising program. In this fast-paced world of television, 30 seconds is not a whole lot of time to tell the world about your business. We're giving more time right here on Arkansas Showcase. Welcome to Arkansas Showcase. My name is Tracy Douglas. This morning we are talking with Arkansas Specialty Orthopedics. This is Dr. Robert C. Matthias, Jr., MD, and their phone number is 663-3647, and they're located at 600 South McKinley. We're going to be giving you some very important information this morning, so write down the phone number. Also, go to their website, and I understand it's a fabulous website, tons of information to access there. All right, first of all, Dr. Matthias, why should people consider Arkansas Specialty Orthopedics? What do you think makes you guys stand out from the crowd?
I think we're different because each of our surgeons is fellowship trained, meaning we've all done additional training beyond medical school and residency to specialize in one particular area of orthopedics. We have surgeons who specialize in spine surgery, joint replacement, foot and ankle, sports medicine, hand and upper extremity. We have all the specialties within orthopedics covered with surgeons who are fellowship trained.
So a whole another year or so of training.
Correct. Most of the fellowship training is an additional year after residency to just focus our attention on one particular area of orthopedics.
And I guess you're very proud to say that either most or all the surgeons in your group are fellowship trained?
That's correct. All the surgeons in our group are fellowship trained.
And that may not necessarily be the case with other organizations.
That's true. Fellowship training is not something one has to do. One can finish residency and go out and practice more general orthopedics, but we've all specialized in particular fields within orthopedics.
So if you want that extra special care, and most of us do, make sure they're fellowship trained.
Yeah.
All right. Now you specialize in hand and what, to the elbow?
Hand and upper extremity. I do from fingertips basically to the elbow.
Okay. And so what if somebody has tingling in their hands? Does that mean a word that we hear a lot of the condition is called carpal tunnel syndrome? It's a syndrome?
That's correct.
Would that necessarily mean that they have that?
Well, numbness and tingling is a very common complaint of patients that I see in clinic. The most common cause is carpal tunnel syndrome, but that's not the only cause. And it's important to know that there are other conditions that can cause numbness and tingling that can mimic carpal tunnel syndrome. It's not uncommon that I refer a patient to treat their carpal tunnel syndrome, and with examination and testing find out that they have a problem instead with their spine or with their elbow, some other place that's causing the numbness and tingling.
The knee joint is connected to the, the old song, because it's all connected.
Correct.
So if you discover that somebody has, let's just carpal tunnel syndrome, for example, what is the treatment for that? Is that surgery?
There's surgical treatment available, obviously, but that's not generally how we start. There are more conservative measures, splinting and anti-inflammatory medicine. Injections can be helpful, but surgery is a very helpful treatment as well.
Well, besides carpal tunnel syndrome, what other types of conditions would you treat?
I treat all conditions of the hand and upper extremity. Common complaints that I see are patients with hand pain. It can be arthritis, can be tendonitis. We also take care of trauma, so fractures, other injuries of the hands and fingers, masses of any kind. Really any problem with the hand and upper extremity we see and treat.
Well, there's the website. On the website, I understand there's a lot of information and probably some questions answered. But we're also giving this phone number, 501-663-3647. So there's a picture of the website. So people can call and make an appointment. They don't have to have a doctor's referral, or how does that work?
It varies depending on your insurance. With certain insurances, you need a referral, but we can help you through that. If you can contact our office, we can help you figure out your insurance and what you need to do to get to our office to be seen and treated.
What if we have a viewer that, they're having problems with their hands, they're having trouble opening their door or opening a jar, and they don't know if it's carpal tunnel syndrome, they don't know if it's arthritis? Can they call that number, and who will they speak to?
Sure. They'll contact that number, and they'll speak with someone who can get them scheduled for an appointment to see me or any of the other hand surgeons in our office.
Okay. So you need to make an appointment to see what's going on,
to
see what's wrong.
Exactly right.
All right, 663-3647, there's the phone number, and again, the website, we're going to put that up there. The website looks great. We always want something easy to maneuver around, and 663-3647, give them a call. Okay, arthritis, a huge problem for so many people. I mean, it is debilitating. What kinds of options do people with arthritis have?
Arthritis is a very common complaint that I see. There are a number of different options. Again, I generally tend to start treating conservatively with splints and anti-inflammatories. That often is enough to help patients get through and do what they need to do during the day. But there are also a number of different surgeries that can be helpful. Arthritis at the base of the thumb is a common complaint, and there's a common surgery that we do that's very useful for eliminating pain while still allowing for motion and allows patients to perform normal activities. There are joint replacements similar to the hip or knee, although different in many ways. They can also be useful for patients with certain types of arthritis.
All right, Dr. Matthias, great information. Thanks so much for being here. 663-3647. Give them a call. Let them help you out. Thanks for being here. We'll see you next time on Arkansas Showcase. Take care.